So now you know that swelling may be a hernia. You have learned what a hernia is, why it can come and go, and when it may become dangerous. But what can be done about it? That is what we are discussing in this conversation. What happens next? How hernias are treated? What to watch for after hernia surgery? And what can increase the risk of complications or recurrence? Because early care is not just about avoiding danger, it is also about planning safely. Treatment depends on the type of hernia, the size, the symptoms, the patient's health, and whether there are complications. Some hernias may be watched for a time if they are small and not causing symptoms. Some hernias need planned surgery. Some hernias need urgent or emergency surgery. Surgery may be done using an open approach, where a single larger incision is made to access and repair the hernia. Surgery may be done using a minimally invasive approach, where a few small incisions are used to access the abdomen and fix the hernia from the inside. Some repairs use stitches. Some repairs use a soft, flexible material called mesh to support the weak area. It works like a patch, helping to hold things in place and lowers the chance of the hernia coming back as your body heals around it. Open surgery is not automatically a bad thing. Minimally invasive surgery is not automatically the best choice for everyone. The best option for a long-lasting result depends on the hernia and the patient. Emergency surgery is not the same as planned surgery. That is why early evaluation matters. It gives the patient and surgeon time to discuss the safest approach for that patient. After hernia surgery, some pain, soreness, swelling, bruising, and tightness can happen. But overall, you should notice gradual improvement over time. Watch for fever. Watch for worsening pain. Watch for increasing redness, warmth, swelling, or drainage from the incision. Watch for inability to tolerate food or water intake with persistent vomiting. Watch for general swelling in the belly. Watch for inability to pass gas or stool when that should be returning. Watch for trouble urinating. Watch for shortness of breath, chest pain, fainting, or severe weakness. Watch for a new or growing bulge. Also, remember that minimally invasive surgery is still surgery. Smaller cuts on the skin do not mean the body has not gone through a major operation. Healing still takes time. With open surgery, the incision is larger, so wound care and pain control may vary. In both cases, follow your activity and lifting instructions carefully. Even if the skin looks healed, the deeper tissues are still recovering. Some people have higher risk of complications or recurrence after hernia repair. Risk can be affected by the type and size of the hernia, whether it is your first hernia or one that has come back, whether the surgery is planned or an emergency, whether the person has an active infection at the time of surgery or the intestines were involved in the hernia, whether the person smokes cigarettes, vapes, or uses other nicotine products, whether they have obesity or any other reason for increased pressure on the abdominal wall, whether they have diabetes, a history of, or underlying risk for poor wound healing, whether they have chronic cough, whether they strain from constipation or difficulty urinating, whether they go back to lifting heavy things too soon after surgery, especially without support, whether they are not eating well or getting enough nutrients, whether they are taking medicines that can slow healing, like steroids or drugs that weaken the immune system, whether there was infection after surgery. This does not mean a person directly caused their hernia, and it does not mean a hernia repair will fail. It means these factors should be discussed early so the patient and surgeon can plan as safely as possible. If you are told you have a hernia, ask these first. What type of hernia is it? Where is it located? Is it small or large? Does it still go back in? Is it safe to watch for now? What symptoms should make me seek urgent care? What activities should I avoid? Do I need surgery now, later, or only if symptoms change? Would open surgery or minimally invasive surgery be better for my situation? Would mesh be used for my repair? What are my risks for recurrence? What can I do before surgery to reduce these risks? What should I watch for after surgery? When can I return to work? Exercise, lifting, driving, mowing my lawn, and resume other normal activities. Do not ignore a new site of swelling. Do not keep forcing a painful hernia back in. Do not wait at home if there is severe pain, vomiting, fever, skin color change, swelling in the belly, or you become unable to pass stool or gas. Do not assume a painless hernia will always stay harmless. Get evaluated early and establish care with a trusted, qualified medical professional. Ask what type it is. Ask what symptoms should worry you. Ask whether planned repair is needed. And if surgery is recommended, ask how to reduce your risk before and after the operation. A hernia may start as a small swelling, but it deserves understanding. Because a hernia is not just what you see on the outside. It is a sign that something inside is pushing through a weak spot. Sometimes it can be watched. Sometimes it needs planned repair. Sometimes it becomes an emergency. The safest time to understand it is before it becomes trapped, painful, or dangerous. So, if you or someone you love has a swelling in the belly button, lower abdomen, groin, or other parts of the belly that comes and goes, is getting larger, is becoming more painful, or is causing concern, please get it checked early. Do not wait until it becomes an emergency. This is Med Affairs with Dr. Osa. If this helped you pay attention to small changes before they become dangerous, share it with someone who might need it too. Until next time.